Hello, and welcome to today's webinar on the psychosocial considerations for women in Duchenne. My name is Maina Scavina. I am part of the clinical care team at PPMD and also a neurologist here at Nemours Children's Health in Wilmington, Delaware. I'd like to ask you if you have questions today during the talks, please feel free to submit them in the chat. And then at the end, we will have 15 to 20 minutes reviewing those and asking our speakers for their thoughts on these, on your questions. So while we often think of all the medical aspects that surround Duchenne, the emotional impact on caregivers is often overlooked. So today we'd like to acknowledge that and engage in a conversation with our speakers, particularly about their experience working with caregivers and one as a caregiver herself. And so I'd like to start by introducing our first speaker, Dr. Jamie Jackson. She is a licensed psychologist at the Nationwide Children's Hospital in Columbus, Ohio. And she's going to tell us a little bit more about herself and then about her work in this area. Dr. Jackson?
Thank you so much, Dr. Scavina. I appreciate that. Hi, everyone. Thanks for being here this afternoon. I also wanted to thank the planning committee for the invitation to join you all. It's really a pleasure. I am a licensed clinical health psychologist here at Nationwide Children's Hospital in Columbus, Ohio. I'm also a researcher, and that's actually my predominant role. And some of the context of my discussion today is around my involvement, which I feel really lucky to be part of, in a study that was conducted here at Nationwide Children's, funded by PPMD, that we had dubbed the Carrier study. And it was a really neat study in that it was multidisciplinary and included individuals from neurology, cardiology, and psychology. And I'm the one representing that psychology arm of the study. And so I'll be telling you a little bit more details about that. But my background is actually specializing in helping individuals who have cardiovascular risks better care for themselves. And that's how I kind of had gotten invited within the realm of Duchenne, was due to some of the cardiovascular risks, not only of the boys, the sons with Duchenne, but also potentially with women who are carriers, manifesting carriers. And so that's how I kind of had gotten involved in this study. But today, I'm going to kind of expand that discussion a little bit. I'm going to share my screen here. I wanted to expand this discussion first today with talking a little bit more generally about some of the psychosocial considerations for women in Duchenne, including an introduction about the many roles that those of you who are listening in today on this webinar may identify with, because I certainly think this is part of what makes up our psychosocial experience. So many of you who are listening today are likely mothers. The role of mother in of itself has certainly its ups and downs, its challenges, as well as its rewards. But within the context of Duchenne, we also have to acknowledge that this role comes with the role of a caregiver. Now, as a mother myself, I can certainly identify with the fact that I too engage in caregiving, but this is really quite different for those of you who are caregiving for a son with Duchenne. In addition to being a mother, there are activities on a day-to-day basis that you are doing that's, not just the okay, let's get breakfast together, let's get this going. It's transfers, it's, helping with dressing, it's actually helping with feeding. It's going above and beyond just what that role of a mother is and extending that into the role of really a true day-to-day caregiver. So this alone has unique features and implications for, just stress and our psychosocial well-being. But now you add on top of that additional roles in your life. And that could be, for example, also being a patient yourself. Now, whether that's being a manifesting carrier, for example, or just having your own health considerations that occur as part of life, as part of aging, this too impacts your ability to perform these other roles in your life, including being a caregiver. In addition to that, you could have other roles such as being a partner, having a spouse, for example. And while this can certainly be a source of support and bolstering your ability to kind of cope with the day-to-day stressors that can come along with these other roles, sometimes, being a partner also can be a little bit of a stressor in of itself. Maybe there are some obligations as part of that role as a partner that we will feel sometimes pressured to have to engage in. And that can also go for things like, for example, being a daughter and having that role. You may even be overlapping that role with being a caregiver if you have aging parents, as an example. And on top of that, we also might be identifying with being a sister and a friend. And once again, these are things that can really help support us and bolster us. But also sometimes we feel like we have to feed into those roles and take out of our bucket to give into those roles in a bucket that isn't necessarily full to the top to begin with because of these other roles that we play in our life. And in addition to that, we may identify as a professional and have a job that we really care about, but also feel really pulled in different directions in satisfying these other roles in our life while also still being a professional. And lastly, being an enthusiast. And what the heck do I mean by that? Well, having hobbies and activities that you really enjoy and actually can bring a great deal of stress relief when you engage in them. And yet sometimes we might feel guilty or burdened by trying to say, oh, I really want to be able to do these things, but I can't because I have to engage in these other roles. So I think it's really important for us to kind of take the concept of a caregiver within the realm of these many other roles in our life and what that may do or play on our psychosocial well-being. So let's bring this back specifically to muscular dystrophy. We know that caregiving, regardless of the context, is one of the most stressful things that we can do in our life. Lots of research to suggest that, regardless of what the specific circumstances are. Now, there's really limited, but there is some research out there about the physical and emotional consequences of caregiving within the context of Duchenne. There certainly is a toll that is taken with the day-to-day activities that are a part of caregiving on top of these other roles in one's life. Now, this is where I want to pause and talk a little bit about some of the findings from the carrier study that we had conducted at Nationwide Children's. Now, you can tell by the study title as being a carrier study that really we had some wide-reaching aims that kind of expand past what the discussion is going to be about today, and including things like genetic carrier status amongst the women. Today, though, what I want to focus on is one of the pieces that I was really interested in and had focused on as part of the study, which is that caregiving role, kind of regardless of one's, carrier status. And so particularly today, when I'm talking about the women who were included in this study, I'm talking about moms who had at least one living son with muscular dystrophy, and that could have included both Duchenne and Becker's. And we were comparing these moms, and I will continue to call them mothers, to a control group, which was basically women of a similar age and socioeconomic status as the moms who are in our group. And why is that important? Well, so often when we are trying to examine something like caregiving, caregivers, regardless of what type of caregivers we're focused on, end up getting compared to individuals who don't match very well. That could be age, and of course, age makes a big difference in our psychosocial experience. It could be their socioeconomic background. So that might be their level of education, their annual income, and other features of how these individuals live and self-identify. And it's really important for us to try to match those up the best we can from a research standpoint to really make sure we're comparing apples to apples and not apples to oranges. And certainly it's really hard to ever truly get to the point where you're comparing real apples to apples, but we're trying to get as close as possible in research so that we can say what we want to say with the results in a way that we feel more confident about what those findings are really suggesting. So we did publish a paper, and some of the results I'm going to share with you today are something that were published about a year ago in the Journal of Child Neurology. And we looked at several different psychosocial factors, including something called health-related quality of life, as well as symptoms of emotional distress. And just given some time limitations today and the fact that we're really going to kind of hone in on some of these psychosocial considerations for the rest of our talk, I'm going to really focus in on the emotional distress piece. So the first thing that I wanted to highlight from some of the findings from our carrier study were levels of perceived stress that were reported by moms and by our control women who were part of the study. What you can see here by this graph is that mothers statistically reported more perceived stress than our controls. And you can also see that both groups, though, were reporting perceived stress levels that were above a cutoff for this particular type of survey that we used that shows that they really were experiencing at least moderate levels of stress in both of these groups. And I think this is really telling because if you think about the women who were involved as our comparators, a lot of these women actually were nurses in a pediatric hospital. And we know from nurses is that they tend to report higher stress levels to begin with due to just the nature of their jobs. And being a pediatric nurse in particular is known in the literature for being a higher stress type of job. So really when we're looking at, well, who we're comparing our moms to, we're comparing our moms to already a group that probably has higher stress levels than the average woman necessarily would of a similar socioeconomic background. And so this is really telling to see that difference lined up between these two groups. Next, I want to talk a little bit about anxiety and depressive symptoms too, and the differences that we see here. So once again, similar pattern emerges where our moms are reporting significantly more anxiety and depressive symptoms than our control women who were part of this study. The one thing, though, that I really wanted to highlight that when I, found this in the data made me sit up a little straighter was that almost 40% of the moms in our study were reporting clinically elevated symptoms of anxiety, which means that about almost 40% of these women in other contexts, if they were using this type of survey to screen out who may need to be referred for mental health services, almost 40% of these women would have been referred. And that's really striking when you compare that to only 5% of the women who are in our control group. So this kind of brings me to this question of, when do we want to really consider, seeking help? And instead of taking time today to really kind of go through what the criteria are for an anxiety disorder or a major depressive disorder or something like that, I think it's much more helpful to think about this kind of from a 360 bigger overview of how we're functioning on a day-to-day basis. So one thing that I think you would want to ask yourself is, am I able to kind of get up and perform my activities of daily living, like getting showered and feeding myself and kind of basically taking care of myself and performing some of those basic duties as a caregiver, as part of that really important role I have? Am I having difficulty doing that? Am I finding myself just sitting in bed and dreading the day, for example? And if the answer to that is yes, then we might want to pause and think about moving forward with seeking some mental health services or support. In addition to that, and you know yourself the best, if you kind of think about how am I doing emotionally, how am I feeling on a day-to-day basis? And if you feel like you're going weeks on end with just not feeling like yourself, so I'm not talking about kind of the everybody's got a bad day, we all have our ups and downs, but for weeks or months period of time, you're like, I am just not feeling like me. I'm no longer finding any joy in the things that I usually find enjoyment in. This is yet another indication that we probably want to reach out and receive some mental health services. Now, the light at the end of this tunnel is that we know through research that treatment for things like anxiety symptoms and depressive symptoms are really effective. We have great treatments out there. That could be medication, that could be talk therapy, or that could be a combination of both medication and talk therapy, whatever's right for you. And a mental health provider can certainly help you walk through those options and figure out what is best for you and your schedule. Now, I know some of you may be listening and thinking like, Wow, Jamie, how in the heck am I going to fit in yet another appointment in addition to all of the things I'm already doing once again in service of this really important caregiver role that I have? And I think one of the few silver linings, if I can say that it's a silver lining, that has come out of COVID is that it has really moved us forward in the realm of telehealth. And I think that this is an advancement that benefits lots of people in lots of circumstances from lots of different backgrounds. And I also believe those of you who are engaging in this caregiver role that really does take up so much of your time and energy, literally only so many hours in the day. When you have access to telehealth, it allows you some flexibility in accessing this type of assistance without necessarily have to getting in the car, drive somewhere, finding somebody to assist your son while you're not available, and really opens the door to being able to fit this in a schedule that can work for you. So before I turn it over to Kylie and Gretchen here, my co-presenters, I wanted to kind of end with just the notion of resilience, which the American Psychological Association, and of course there's lots of different definitions out there, but the definition they use is the process and outcome of successfully adapting to difficult or challenging life experiences. And I know Kylie is going to be talking a little bit more about this in just a moment, as will Gretchen. And what I want to say is that sure, we've got evidence out here about how difficult this caregiving is, but the good news is these same roles that we play, if we think about them differently, if we get help with kind of adjusting the way that we utilize some of those roles and we think about some of those roles, we can also turn these things into a way to bolster and boost our ability to be resilient. It can also help us build our armor as we go forward with these additional challenges as part of this caregiving role. And I really look forward to hearing what both Kylie and Gretchen have to say about this next. So thank you so much for your time, and I look forward to answering any questions afterward.
Thank you so much, Dr. Jackson. That was really great. So we'll circle back and have some questions at the end. I'd like to introduce Kylie Winstead. She is a licensed social worker currently at Duke University, but previously at Kennedy Krieger Institute. Kylie, please tell us a little more about yourself.
Yes, of course. I'm going to share my screen. Thank you, Jamie and Dr. Scafina. I'm so excited to be here. And I also want to thank PPMD for this wonderful opportunity to be here. This is near and dear to my heart for sure. So again, my name is Kylie Winstead. I'm a licensed clinical social worker. I worked at Kennedy Krieger Institute for 10 years and just recently had a transition, moved to North Carolina. But since 2015, I was in the Center for Genetic Muscle Disorders at Kennedy Krieger and was their full-time social worker. So that was a huge part of my role at Kennedy, and I was also in some other medical clinics as well. So I've worked with children, adolescents, and adults with a chronic medical condition since 2012. Prior to this last role at Kennedy Krieger, for 3 years, I worked in therapeutic foster care with medically fragile children as well. So definitely a huge interest of mine to work with this population, and love to kind of share a little bit of what I've gathered working with families thus far. So I'm going to kind of piggyback off of Jamie, kind of what she was just kind of talking about, the different psychosocial considerations that can happen both for the son or the boy that has Duchenne or Becker, and also the family. And whatever, sorry, I'm just moving my camera. Whatever family members that are involved in that person's life. So I kind of put it side by side here just to kind of look at some of the similarities that family members go through. But we'll focus on the right-hand column right now for family members. That just to be in that caregiving role, right? There's many additional factors that may play. Your routine, right, may drastically change even week to week with different appointments, the demands that are on you as the caregiver, And we're talking about women in Duchenne. So we can even broaden it to a sister of a boy and the impact that it has on her, or a wife of a man with Duchenne, and how that impacts the demands on them, those women as well. Connection to others, and I believe Gretchen will talk a little bit more about this as well, right? Sometimes that isolation, we withdraw and don't have as many social connections because there's just not enough time, or you might still be at a place where it's really hard to talk about. So you withdraw from folks, and that may have a huge impact on you as a mother, a caregiver, the whole family. Feelings of anger and guilt that may pop up, and sadness, right? Those are kind of what Jamie was talking about. And when you really kind of notice that it's impacting your day to day, if it's at the point that maybe getting some extra support. Grief and loss is a huge thing that pops up with many of the family members that I have worked with over the past several years. And that could even just be when your son loses the ability to walk, right? The grief and loss around that huge change for them as an individual and you as a caregiver. So with living with a family member with Duchenne, there's changes throughout their lifespan that can really impact emotionally, physically, a family. And long-term planning, that is another thing that families have to focus on. I believe Gretchen might touch on that as well, just in terms of you might have to start that process earlier than you originally expected, and just kind of, and that's also another task that's put on your plate as the parent and caregiver. So these are just some things that may pop up for families that can have an impact. So coping and adjusting, just some thoughts here. And my little icon in the is very important, and similar to what Jamie said, when your bucket's low, it's hard to perform that role as a caregiver, right? So you can't pour from an empty cup. You have to take care of yourself, and I'll jump way to the bottom and then I'll go back. Self-care is something that I talk to families and parents a lot about. And I know there's barely time to do it with all of the roles that you have, but it is very, very important. Even if it's a 15-minute long hot shower where you're just by yourself, or you get to watch your favorite show at the end of the day, whatever that may be, to try to carve out a little bit of time for yourself. So two things that I think is important to kind of help with the adjusting period. And that's what I think, like the Centers of Excellence, which PPMD has kind of, right, helped us form Centers of Excellence across the United States, and to help families during this time of diagnosis and changes, right? Knowledge is power. It might be overwhelming and a lot to take in, but reliable information for a family is very important to kind of help with that adjustment process. And that family-centered approach from a medical team, that was something we always try to do at Kennedy. Is it's not just the son, it's the whole family, and how can we support the whole family through this process? And I think that can be a sense of support for the family, to know that the medical team kind of sees the whole family unit. Extended family and community supports. That's an important aspect. I feel like being connected to others, and that's something Gretchen will touch on, but it can be a huge support. It's not for everybody, but leaning on that family member or others in the community or other moms and boys with Duchenne, that can really kind of help provide some support. And like Jamie had said, and I'll get a little bit more into, right, seeking psychotherapy for yourself, or possibly medication, support groups. Those are all avenues to try to just have another layer of support. But Like Jamie said, you know yourself the best and what works for you, what fills your cup. It might be attending a support group, or it might just be making sure you have 20, 30 minutes by yourself every afternoon. It's whatever fills your cup. And a lot of kind of similar coping and adjusting strategies for the boys themselves. I'll just touch on that one over the enjoyment, quality of life, and values. And that's important in terms of what is important to both you, the individual boy, and then the family. What's important to you, what you still want to work to. And I'm going to talk a little bit about that in the next slide in terms of a particular therapy model that really focuses on that. So these last two slides just kind of talk a little bit about some supports that I have recommended to families, that I have some knowledge in, that I really think are supportive approaches. So a particular therapy model, it's called ACT, A-C-T, Acceptance and Commitment Therapy. It was developed by Stephen Hayes, and it's a rather newer treatment modality. It's under the umbrella cognitive behavioral therapy, which is another excellent approach. But this acceptance and commitment therapy really focuses on those 5 bullet point areas. And the main focus is values. What is important to you as an individual? What do you want to work towards? And how can you still work towards it even though there's hardship and in the midst of adversity? So this is a treatment model that I use with adults that I see for ongoing therapy that have muscular dystrophy. It's helping them to still focus on what's important to them. Maybe travel is important, or seeing the world, and how can we get you to that point? So it really focuses on being present in the moment, right? A lot of times we get caught up in the what ifs of the future, which is very understandable, especially wondering about the future of your son and the family. That's very common. But this helps us to try to stay in the present moment. Separating from our thoughts. That's in terms of, for an example, the thought of I'm not enough, or I'm not doing enough as a caregiver or a mom. That's just a thought that popped up in our heads. We have these automatic thoughts all the time. It doesn't mean that it's true, right? So trying to separate ourselves. Like, that was just a thought that I'm having. I'm having a pretty tough day. So I had the thought of I'm not enough for my son. But it's trying to separate that you're just having that thought. It doesn't mean that it's true, right? Values, what's important to you, that you want to focus on having a family vacation this summer. And what steps are you going to do to get you there over this next year? Committed action, right? What actions are you taking towards that value? And acceptance is a pretty strong word, right? We may never accept that our son has Duchenne or our family member has Duchenne or muscular dystrophy, but trying to work to a place of openness and willingness that this is where we're at, and how can we still move forward towards what we want. The huge, I'll say one little, this therapy model uses a lot of metaphors, and this metaphor has stuck with me, and I just think it's very, very fitting. Whoever has ever tried to push a beach ball under the water, right? It's hard to do. And as soon as we let go, it pops up into our face, right? So think of the hardships in our lives, the struggles, the challenges. Think of that as the beach ball, right? If we try to push it down, push it away, it's just going to pop right back in our face. So try just to let it gently float on the top of the water, right? Whatever that tough thing that's happening, just let it kind of sit there, float. And it's actually going to float a little bit away from you eventually, right? So there's going to be some distance. It's not going to be as intense. And it's there, you can see it, but you're still able to focus on the other things that are important to you. So I thought that I use that a lot. I think it's a pretty neat analogy, metaphor to kind of the main purpose of this is that you are where you're at. You can't necessarily change things, but how can we best move forward? And my last slide here, and like Jamie was saying, we think that we might need a therapist for ourselves. Psychology Today is an excellent resource. You can filter by zip code, you can filter by your insurance, you can filter by chronic illness. So you can try to find a therapist that has worked with others and have themselves or a family member with chronic illness. I am happy at the end to pull up this website if anybody wants me to show you how to navigate it. I'm more than happy to do that. But that is definitely a huge resource to find a therapist in your area that possibly might be knowledgeable about working with folks with chronic illness. You can always, the certified Duchenne center that you attend, get connected to their social worker and have them help you find somebody. And then also another resource is the PPMD Connect group. So those are just other avenues if you want to connect with an individual therapist or a group of other parents. Some resources. So that kind of wraps up my section. Just a little bit about how the possible impact, different ways to possibly cope, and a particular therapy model that I think is very beneficial for both people who have muscular dystrophy and their family members. So thank you. I will turn it over to Gretchen now.
Great, thank you very much. I think having the strategies are very important and something that I'm glad you brought up. And I hadn't heard that metaphor before, and it's very visual, so I appreciate that. Thank you. And so next we have Gretchen, who is currently a candidate for social work program, but also a mom of a young man with Duchenne. And so I will turn it over to her. Gretchen.
Good morning. My name is Gretchen Agans. I am a MSW candidate at Columbia University in New York City. I fill a lot of those roles that we talked about earlier. I am still a partner. We've been married for 31 years. We've been together 36 years. That fortunately for me, that's super stable. I was a professional. I had a private consulting practice that operated in both New York and Atlanta for over 25 years, not simultaneously those two cities, but it was a deliciously lucrative career that I really enjoyed. And then Liam was diagnosed. So this photo is us in the big before we knew what Duchenne was, before everything sort of crumbled. These young people are now 24, 22, 17, and the twins are 15. The twins were a little bit of a surprise. So this whole thing was sort of like a 1-2 punch a little bit. I wasn't expecting twins, and I definitely wasn't expecting one of them to sort of be in this situation. So this is an example of how our universe imploded. It seems to be a fairly common story from what I hear from the moms in my circle. But, Liam was diagnosed really late. I just thought he was a late bloomer. He was the youngest of 5. He was just kind of clumsy and not for nothing, but I was kind of paying attention to the other kids too, right? I had a lot going on. And we brought him to all of his doctor's appointments. I mean, nobody knew anything, we knew something was wrong, but we just thought it was a behavioral issue. So we kind of started going through those steps. We had him evaluated for Asperger's, and which allowed the county to get involved when he went to school, and they started doing their own tests, and they said, well, we really think you should bring him to, your pediatrician. I'm like, well, I don't know what we're looking for. He's been to his pediatrician, like, and they said, you know, we can't really diagnose, we're just a school. And the lady on the phone, so she was, thank goodness, she says, well, I can't really diagnose, but I think maybe it's muscular dystrophy. I'm like, oh, okay, I didn't know what that meant. You know, getting through the neurology appointments were very, very long. Just time wise, you know, between making the appointment and waiting, and you know, between the first appointment and getting the actual lab results took months. Just, it took forever. And there was no caregiver support. There was nothing. It was like, oh, well, you don't really know. We don't really know. Just wait and we'll see. And, you know, when you start realizing something's really wrong with your child, like there's not a lot of folks out there who have internet access who are just going to sit tight. So I did what I thought most people would do. I got online, of course. I didn't know anything about Duchenne, but I did know MDA. I grew up with all the telethons and whatnot. And when I pulled up MDA, they didn't even have everything listed as one section. It was crazy. I had to search through them all and open them one at a time. And then I saw the Gowers maneuver. I saw this picture and like my chest caved in and I was alone. It was awful. It's just the worst experience ever. I don't know how it would have been better if I had been in the doctor's office, if I still had no caregiver support. There was, and we still didn't have an actual diagnosis. So even people I know with other kids who have muscular dystrophy were like, well, you're not really sure. And I'm like, it's like, it felt like I didn't have the membership card yet and I couldn't get anyone to talk to me. And what was so difficult about that is, aside from it just being horrible, in the moment, it was horrible because it set up the foundation for what the next few years were going to look like. I drank for a year. I lost my ability to function. It was awful. And it really does sort of feel like I was trying to get up off of the floor like I had Duchenne. It was incredibly difficult. I had nobody that understood. It was super, super hard. So I started isolating, right? Because that's always helpful. But in the moment, you know, you just go with what works. And, you know, I got swept up in my own whirlpool of thoughts, right? The fear, depression, anxiety, anger, envy, you know, shut up about your healthy kids. I don't want to look at all the fun kids having a good time at baseball practice. Like, it just felt like there were healthy kids everywhere. And I just didn't want to hear it. I didn't even want to go to the grocery store, right? Because once we did have the diagnosis and once it was starting to get out into the, you know, through our circle of people, you know, I would just get myself together and go to the grocery store. And then sure enough, there'd be that one neighbor, oh, and they want to just love on you. And they just do. And it's horrible. They just look at you different now. Everybody looks at you different now, or at least it feels that way, which is even more isolating. You know, I've been to neighborhood functions where they're upset about my life and I'm comforting them. What is that all about? So I just withdrew even more. And that swirl of thoughts kept getting stronger and stronger. And if any of you have ever played that whirlpool game in the pool, right, where all your friends are going in a big circle and you're getting the water to flow, and then you all turn around and try to go the other way and it wipes you out, that's what it feels like. And I couldn't push against the flow of my own thoughts. And I really needed something to break the momentum of that. There are lots of different ways to do that. Therapy is excellent. Being with friends is excellent. You know, there's lots of good tools out there. For me, I chose books. Audiobooks are my best friend because I could have one headphone with a book and I could have my other ear out. So I could listen to what the kids need, because at some point they didn't really need me. I just needed to be around. Or if I'm making dinner, or if I'm driving the kids someplace, folding laundry, all of those ridiculously mundane tasks that come with caregiving sometimes allowed me the opportunity to delve into my books. And what was helpful about that was I also had the opportunity to choose things that were inspiring. I chose the opportunity to learn so that way I could try to get myself out of the situation I was in. So I was learning to reconnect with myself and try to figure out how to pick up the pieces of my life, because there was no going back. I was trying to climb out of the chasm of the before and after. So I found art journaling. I love art journaling. You can journal, you can just write. That's great. You can doodle in it. You can make it an art piece. But what is helpful is even just writing 10, 15, 20 minutes a day, scribble your thoughts down, has been shown to produce measurable changes in physical and mental health. And it really can help you connect with others because it allows you a way to get rid of some of the real heavy things that are prohibiting those opportunities for connection. So as I was trying to get back out there, it was like, well, who has time to spend with me? It's like, what can we do that's affordable, right? Time and money is the cosmic dance. And if we got to kind of figure that out, especially as Duchenne families are all over the place. They're not necessarily in your neighborhood. It's not like you're going to hook up at the baseball field because the kids are in Little League. You've got to be a little bit more intentional with it. But just because you share a diagnosis doesn't mean you share anything else, right? You got to kind of figure out where your people are, so who are the people who you can trust and understand your boundaries, and when you're just overwhelmed and when you need a little bit of extra assistance. So these are my people, right? And it started off because we all were at the same rare disease research clinic together. We would just run into each other randomly week after week, or, sometimes I'd see Alpa and the next week I'd see Beth, but we just kind of kept running into each other. And then those conversations would turn into like, well, you guys are going to camp this summer, right? Like, I don't know, what is the message for camp? And so then we would start sharing information on how to get the boys to summer camp. Then one of the ladies found a respite house that's in our area. And so now we started doing respite weekends. We've been on 4 or 5 of those. And then because I developed a closer relationship with Alpa through those things, now she's like, she was the Connect coordinator for Georgia. So she's like, you need to help me. And I'm like, how can I say no? We have matching tattoos. Fine, let's go do this thing. And so now we spend even more time together. And it's these little opportunities, like the marble jar in the example before, right? It's, it's these opportunities that you spend with people, and every time, the situation where trust is like protected, another marble goes into the jar. So I have marble jar friends, right? And she is one of those people, Beth and Shelly and Brandy and Stacy, they're all really important to me. So when things get really bad, we can start reaching out to each other in a way that's different than with other people. I don't have to try to explain, or like they just don't understand. They can't really. And I'm glad that they don't. I'm glad that they don't know what this life is like. Nobody wants this, so really, as we spend more time together, we share a little bit more of our story, and our trust grows. When news from other Duchenne families knock us to our knees, we reach out to each other and offer and receive comfort. We whisper our deepest fears and our failings, and trust grows again. And when the hardest days are upon us, we will be safe in this network of dear friends, woven together with time and trust and love that will catch us as we fall. So I highly encourage you to find your people. I know it is not easy, but those connect groups are really trying. And if you feel like you're ready to volunteer, like we could really use some help, find the people in your area, because they are definitely out there. And I'll turn it back over to Marina.
Thank you so much. That was really wonderful and very personal. So thank you for sharing that with us. And I have heard about your group in Georgia, and I think that would be a very nice model for people either trying to start something together, because I'm sure that it can be very comforting, supportive. So thank you for sharing that with us. We did have a question that came up in terms of resources. and if we could share resources that might be helpful. I would encourage folks also to look at the Parent Project Muscular Dystrophy website for families who may have been newly diagnosed. There's information specifically for newly diagnosed families, information, resources, support. You can contact PPMD. There are individuals from the care team that can speak with you and your family about any particular issue you're having. Really, they're very comprehensive. And I'll leave it open to the panel too. If I know, Kylie, you had put up some information for Psychology Today, and if there's other resources you think folks can look at.
Yeah, I actually was just gonna, I'll try to put something in the chat as well. I think another great resource that really piggybacks well with what Gretchen, you were just saying too, as well as Kylie, what you had presented earlier. Let's see if I could just share my screen momentarily and find the right one, because I have too many windows open and I can already tell this is gonna be a problem. Oh, here we go, okay. If everybody can see this. So this is on the American Psychological, not to make everybody sick with scrolling. This is on the American Psychological Association website. And I think we can be able to put this link in the chat too, so everyone can check this out. I just think this is a really nice digestible resource about some additional strategies for building resistance. And again, I'm going to try not to scroll too quickly for everyone. But not only does it talk about, what is and isn't resilience, but here are some of the things that they actually go through talking about how to build that resilience. And Gretchen, this goes right to the point that you were just emphasizing, building your connection, prioritizing relationships, joining a group, having that connectivity. They also talk about the importance, again, of fostering that wellness. And Kylie, you had really done a great job emphasizing the self-care component. And this is why you've got to not only take care of your mind, also your body. There's a few different ways of going about doing that. And, I know that time is of the essence, and it's not a resource that you have in abundance, but it's also incredibly important in order to keep building that armor and moving forward. And then they also talk about a few other things. I won't go into a lot of lengthy detail here, but, finding purpose, journaling. Gretchen, you talked about journaling. I think that's another way to help kind of find that introspection and finding some of that purpose. I think it's a really great tool for that. And here's coming to some of the therapy kind of resources, including ACT and other types of cognitive behavioral therapy, embracing healthy thoughts. And it kind of walks through some of those too. So anyway, I just wanted to share that with the group. I think this is a really great kind of summary resource for folks as well.
Thank you. And also, there are, the certified centers, the clinics, again, as Kylie mentioned, speaking with the social worker in clinic, asking for assistance through psychology. There are resources, even palliative care, which we won't go into too much, but there are other resources available in the hospitals. Sometimes they're very evident, and sometimes you do have to ask for them or talk to your providers, your doctors, nurse practitioners about that. Duchenne also, PPMD also has a connect group. So as Gretchen mentioned, every state has a connect group with families that can help support and provide resources. So that information is also on the PPMD website. And, one question I had for all of you really, and Dr. Jackson, I was thinking in your study where 40% of the women were found to have, relatively high anxiety levels, you were testing them. But if they weren't being tested and had this at home and thought, well, maybe I don't seek pleasure in anything that I used to, or I feel not to be myself, who could they turn to initially? I mean, I think for some people, that's the rate limiting step. They just don't know how to make that first step. So the telehealth, these online resources, but also would you recommend talking to your family doctor, your OBGYN, local other providers you may have?
No, that's a great question, Dr. Scavina. Thanks for asking that. And, we were even talking a little bit before, the webinar started about just the lack of, mental health service providers out there right now. And especially with COVID, it certainly hasn't made anything easier, and certainly wait lists can be long in some circumstances. But all of that being said, and again, I do think the telehealth has really helped improve access to some of this. The first step is finding a route that's going to be comfortable for you, just to take that foot forward. And that might mean talking with a trusted, health professional that you already work with. Maybe that is your OBGYN. Maybe that's your primary care doctor. Maybe that's even talking to your son's neurologist, right? I mean, if that's the team that you've built a relationship with, and they may at least be able to help get you steps towards finding that provider. That might be first talking with a social worker who can do some additional assessments with you and then figure out what the right way to go is. The other thing that I encourage folks to do, because I also think that insurance tends to be a really limiting factor for some people, whoever your insurance provider is, you can always go to their website and they have provider finder functions. And oftentimes you can actually search by mental health providers. And you can see who's already in your network and who's within, a certain distance from your home. And sometimes that alone can be the step forward that it takes to be like, okay, at least I know that, I'm not going to have to pay out of pocket, for example, for this service. So those are a couple of my initial thoughts, but I certainly think if there's any kind of consideration where you're like, I really think I should talk to someone, find somebody trusted who's a professional who you're already working with, start there, if nowhere else.
Yes, I definitely agree. I think any trusted, like you said, even your child's pediatrician, just ask somebody and they will most likely point you to somebody else or in the right direction. I can pull up Psychology Today real quick. It'll just take a moment and I can kind of show you, because the treatment modality, if you were looking for somebody that is specifically knowledgeable. So let's just say, right here is let's say Baltimore, Maryland. So therapists in Baltimore, Maryland, right? But then we want to go, say you have Aetna, so then you can filter by Aetna. And now here's all the Aetna therapists in Baltimore. And types of therapy. So here's the acceptance and commitment therapy. If you wanted somebody that was trained in that and accepts Aetna, that's a filter. And one other thing that I often do here, it's under issues, chronic illness. So this is what I would, if somebody were to ask me, come to Kennedy Krieger, hey, I have Aetna, I live in Baltimore, and can you help me find somebody that's knowledgeable? This is how I would filter out. And then in finding a therapist is also about feeling comfortable, right? You might not mesh well with that person. So it might be trying one or two people or calling and having some of these you would click and then you would see that they might offer like a 15-minute free phone consult. And they kind of share a little bit about themselves to get a feel. So this is a good way if you feel comfortable doing it on your own. I do also recommend like just talking to any trusted professional, anybody that kind of might point you in the right direction. But if you feel comfortable on your own, this is a great tool. These people are credentialed, they're vetted, verified by Psychology Today, and you can kind of put in those filters.
Great, that's a great tool. I was not aware of that myself, so thank you very much. And I think all of us know as well that there may be a shortage in your area of mental health providers. So you may have to go out of your region, but if they take your insurance, you're able to make an appointment. So at least looking through those lists, I think that'd be really super helpful. Yeah, I have to say, even in my own place of work for those working, I think that institutions are making a greater effort to provide wellness and mental health support. And so not only to an individual, but even to their families and family members. So if you're at work and your insurance is through your work, seek out what they may provide, because I've seen here a tremendous increase in the services that are provided, not only to a person, but to their family members. And I think it's also, you know, I don't know, I'm a mom and a mother, so moms tend to be the center of the family in a sense, right? But, you know, it's the whole family we're thinking about. So if your husband or your spouse, brothers and sisters also are in need, you know, seeking family help, family support, because really, when the whole family is functioning well, I think people are more able to thrive instead of just survive. And I think that's really the goal of these types of lectures, is that our hope is that people can thrive through this, and not just think, I just need to survive this, need to do what I need to do, but really to continue to look at your values, what's important to you, what are the things you want for your family, right? Someone told me recently, well, I'm using this wheelchair, but I want to go to beautiful places. And the mother, you know, said even to me, their goal is to go to beautiful places in the world. So that is a goal, and that is what, you know, you would want your child, yourself to continue to strive for. So what are your values? The ACT, I think, is really nice in terms of what's important, what can we do now to make our family work well. And yeah, and so I love all these resources. I'm looking here at just some of the other questions that have recently filtered in. And I see here too, Kylie, SIB shops, and that's also for siblings who may need resources as well. I think it's important that everyone has a place if they need to turn to. Do we have social worker appointments available on the PPMD team to support the caregiver? Yes, and I will introduce Alexis Hazlitt. She is part of the clinical care team, and she can act, if you contact her and PPMD, as a case management liaison resource to help with some of this. So yes, contacting PPMD would be very helpful for that. So I think we are sort of getting to that hour. If there are any further questions or anything else anyone would like to contribute, I really thank all of you for joining us. I know you see caregivers from different aspects of your position in life, and appreciate everything you all had to contribute. I think sometimes we feel here in clinic we could do more, right? Because we tend to focus on the child, the young man, the individual, but we know that it's really the whole family that we're trying to take care of. So I would really encourage you to seek the help if you feel that you're in a place that you don't particularly care to be. Seek that help, because I think it will benefit your child, your spouse, those around you, and the entire family. So we hope that this has been helpful. If there are further questions, please let us know. Contact PPMD. The clinical care team is here to answer those questions. And thank you all very much for your time today.